So it's Matt Kendell here. I'm an IEMT trainer and also an IEMT therapist and hypnotherapist. And today I'm joined by Adrian. So people often ask, how long does it take to become certified? And so it's taken you a month. So you've done your case studies, you've submitted them. And what we do is that we then just meet online, do a Zoom, and we go through the case studies. And now Adrian today is going to get his certifications because he's now going to go join the association. And so what today is you've most seen them on YouTube anyway, just basically seeing what Adrian's experience of IEMT was like.
I liked the fact there is a kind of a structure to it. So
Yes,
you're taught more than just waggling your fingers about, which is kind of what you're taught in other similar trainings to this. You know, there's a lot more theory behind it. It makes a lot more sense, and you go in feeling a lot more confident working in this way. When I've done things like EMI, sometimes you get a great result and sometimes you don't, and you don't know why. And so you can't learn from it. That's what's frustrating. If something goes wrong, that's fine, as long as you can learn something to do it better next time. But often you don't really know why it's working or why it's not. It works with some people, not with others. And that's fine for the ones it works on. But when you're not helping the people you want to be helping, it's difficult to know how to recalibrate it. But with this, there is a kind of course correction built into the method. So if there's an emotion, you're working on one emotion and there might be something underneath it, work on that. Weaken the higher emotion, and you can do things like that. And that's what I liked about it. That's kind of what appealed to me, and that's what I think a lot of therapists who train in this will get a lot out of it, especially if they have been trained in EMDR or EMI. They'll find that that's probably, I would imagine that would be the most useful thing they'll walk away with, the kind of flexibility and the option to course correct if things aren't, because people are complicated. Sometimes when you do an online training, you think you're going to be a bit compromised in what you can learn a little bit, but I don't really think it affected anything really. The only, like, obviously the PSACs thing, if anyone hasn't done the course, is a little thing you teach clients to sort of break out of the mental state. That obviously had to be taught in a different way to how it is in the manual, but it still works. So there isn't really any problem, to be honest.
Yeah, it's just obviously it's a body language thing that requires spatial movement, and we don't do that online. We just do it in a different way. But yeah, it does still work. And how are you finding what the results were like? Because some of the people who were in there haven't had any experience of EMI or EMDR or anything. How did you find the results? Also with the demonstrations I was doing and in the private rooms, what was it like to actually use IEMT and see the results that you and other people were getting?
Yeah, it was good. Because it's very immediate. That's the thing. There's always some change, even if, occasionally there might be something that doesn't change as much as you want it to. But that's where the flexibility of the model comes in, because then you work on what might be underneath that. So yeah, there's always some change. It's never just, you're never like hitting your head against the wall sort of thing, which you can do with certain clients and certain techniques where things aren't budging. This will get some change, and there's, like I said, because of the flexibility, you can then work on this sort of structure beneath whatever's, bringing them into the therapy room in the first place. So
absolutely. Because what the client thinks the problem is and what the problem is usually two very different things, so, and that's why IEMT is an outcome-free process. We never promise a solution of what they want. It's like, so it's not like I will stop you smoking in one day or I will help you lose 5 steps. It's basically, we can explore why you smoke, we can explore why you drink, and then you can come up with your own resolutions. But there's a lot more going on underneath than what you might think. And this isn't sort of Freudian psychoanalysis that takes months or years. It's usually 2 or 3 sessions that we do with people. And so with the 2 case studies that you worked on, what kind of issues were they experiencing and what kind of results did they get from having the sessions?
The first lady was, it was kind of like, it starts off like sort of general anxiety. And you kind of just work with that. And then obviously there are other issues that were coming up with her, divorce. So like you said, the issue is never the issue. They present with one issue, you're going to find a load of stuff just going through the process. Like with the second case study, we saw, again, it was just kind of general anxiety. Like when I put out the call for volunteers, I did say, you know, I didn't want to, because these were case studies, I didn't want to work on anything too traumatic. So I just said, general anxiety problems, nothing too, you know, it's just because I'm learning this myself. And yeah, like the second guy, he was just general anxiety, but then you find out about, you know, his whole history, feelings of abandonment, going to boarding school. He had hoiaresis, which is shy bladder. That was something that was really having a toll on him. So all these other things were coming up, which weren't even, you know, we weren't even talking about. And then suddenly it comes up and you just work on those and they have great results and reported back really positively. So,
And were they quite shocked at the results they got in such an immediate way as well?
yeah, especially the first lady, when we were doing there's a simple like introductory exercise you do just on a vague memory, nothing really connected to anything else. You're just giving them a little taster of what's to come. And she was quite shocked that, oh yeah, my entire memory has changed. I see it differently, it feels different. You know, all what we would call submodalities, all the little things that make up the memory were different in, you know, 10 seconds or something, 20 seconds.
Yeah, no, it's crazy, isn't it? And this is why I always say to work with people that you don't know and who don't know about IEMT. Because once you start using the tools and the techniques, you understand just how powerful they actually are. Because they can't play along, so you can't create false positives because they don't know what to do. And so that really shows you how well it does work. Okay, so going forward, you do have your own practice now up and running. How do you see integrating IEMT to what you're doing, and what kind of work do you want to go on and do? What kind of client work do you want to go do?
I generally deal with anxiety and depression, and I quite like working around social anxiety. I find that's a fascinating kind of subject. Yeah, like I said, because of my training anyway as a hypnotherapist, I was already using something called EMI, eye movement integration, which is another eye movement therapy. But I can quite happily supplant IEMT on top of that, just use that as my go-to from now on. I don't see the point of using EMI anymore because it just gets better results, and it's just more, like I said, it's more, there's more to it. You're not just waggling your fingers hoping that someone's going to report positively back to you. You're actually getting, and it's sort of shocking them a little bit with how they can, you know, how it can change in seconds, in space of the room. It's happening for them.
So today we're going to be certifying Adrian if he joins the association today, so we'll be able to get that out for him. If people want to come and work with you, do you have a website or an online presence at all?
Oh yeah, my website is www.adrianjacksontherapy.com. And the only really social media stuff I do is my YouTube channel, which is just Adrian Jackson Cognitive Hypnotherapy.
Brilliant. Well, Adrian, thank you very much for your time. Well done for completing your case studies, and go forth and now use these skills to help change people's lives. And I hope your practice is very successful. Thank you very much. Thank you.